is going on with you?
So what happened was I was actually trying to, I'm not sure, have I told you guys anything? Like, I know I texted you a little bit, but my memory of, I'll just start from the beginning. I was
Okay.
taking the entrance exam for nursing school, and I was sitting on a chair, and in the middle had a grand mal seizure, fell over, but I fell on top of my RNS and had a huge bump, and like I landed really hard, and I didn't realize anything was wrong for the first week because I was just really out of it, but I figured, just had a big seizure. I mean, having headaches, kind of feeling like you can't finish your thoughts, that kind of stuff. That's not really too out of the ordinary for just having a seizure. Um but the headaches, they wouldn't go away, and I had a huge bump on my head, and I didn't even realize, like, for a week, I didn't even I was totally out of it. I bought $3,000 worth of stock. Like, the short-term memory was gone. I bought 3 and the impulsivity, I was just, like, crazy. Did not even know. Luckily, my husband was able to get that figured out, but Jesus fucking Christ, like, I was leaving gas stoves on, I was like an old person needing to be in a nursing home, and I didn't, because that's, like, not, I mean, y you got a little, you have trouble after a seizure, but that's a little much, so when I went to the and, when you hit your head with an RNS, you're supposed to get it scanned, but I didn't even know I hit my head because I was that out of it. And so, yeah, um, I saw about a week later, I saw my doctor and inpatient, and he had this look on his face like, you should have been admitted to the hospital a week ago. And he was like, I kept telling him the problems with my insurance because I was about to lose my insurance and that I couldn't, like, I want to get scanned, but I'm not sure if I could handle an admission right now. And he's like, all right, so well, let's do this. Let's get you at least an MRI, and we'll go from there. And literally the day after I went to it wasn't even the day after, it might have been that night. My head, which is apparently normal for traumatic brain injury, for like the symptoms to really start showing up like delayed, like a week or a couple weeks after. Um, but I just got this killer migraine that nothing, nothing would fix. And I told my doctor, like, I was trying to manage the headache on my own because, again, my insurance, I thought I couldn't go, like, I have to do this on my own, and I thought even if I do go to the hospital, what the fuck are they gonna do for a headache? You know? What are they gonna do? So, I was trying to control it. I took Tylenol, I was drinking like, water and coffee and ibuprofen. I took muscle relaxers, I took a Klonopin, nothing was working. So I tried taking one of the 2 milligram Dilaudid that I had from my kidney infection last year left over, and I realized, well, shit, like, that's the end of the line even for an inpatient hospitalization. Like, they don't even use opioids for headaches and shit. So, um, and I told the I told the doctor that, and he's like, "Yeah, we got to get this figured out." And I just couldn't wait after I saw the doctor, and I just ended up going to the ER, and I was like, yeah, I have a so and they're like, "What, so you have a headache?" I'm like, "Yeah, I have a headache," and, she's like, "Do you have any medical history?" And I'm like, "Yeah, a whole bunch." I'm epileptic, I had a seizure and fell on my head, and then they're like, "Okay." And then my husband's behind me and said, "Well, she just had a brain implant put in and she fell on her head. You can tell this is where the bump is, and this is where her scar is." And then the nurses looked at each other, and then they were like wheeling me back as fast as they could to the, and I was so glad because ERs are like waiting in an ER when you have that kind of shit. When you're in pain, anything, it takes hours to go through an ER, and they just got me back. They got me admitted. I was probably admitted to that hospital in less than an hour. I was upstairs and they tried everything, and they managed to help the headache or the migraine, but they didn't it never actually went away. It was like different severities, and it was caused by the TBI that, and so they did nerve blocks and all sorts of medications. They gave me the Depakote, and I didn't know what they were giving me at first. I was just like, "You know what? Try everything. I consent. Check. You got it. Do whatever you need to do." The Depakote, I had a fucking like manic sort of crazy reaction from the Depakote. So I had to wean off that, not just wean off, but it took a minute to kind of get back to normal from that. They did the nerve blocks. They did a medication called DHE infusion, and it was all helping little by little, but none of it was getting rid of it. And so I was admitted to the hospital on like the 26th. And really, when I was admitted, I just thought, well, they're going to get me an MRI like ASAP. And then, of course, with the RNS and the VNS, everybody was like, "I don't know what to do. I can't get this girl an MRI, but they won't let her leave without the MRI." So I figured I'd just be in there to get the MRI, maybe get a little bit of pain meds, and I'd be on my way. Like, but no, I was in there for a while. I only went there because I thought I could just get the MRI right then and there, get the pain meds. Okay, everything's great. They released me from the ER. No, this is not what happened. I was there for like 5 days to get an MRI because the implant committee would approve my VNS and they would approve my RNS, but they wouldn't approve them together. So they were like saying that I would need two different MRIs, one with this type that's compatible with this, and one that's compatible with this. And like, I knew that my insurance was going to expire at the end of the month. I knew that. So I was sitting here watching the clock, waiting for them to, like, in medical limbo, waiting for them, like, let me go. I got to get out of here because if you keep me past on August 1st, I won't be able to pay for it. What did they do? August 1st, they come in that morning. I still hadn't been discharged. Okay, we're ready to take you to MRI. And that's kind of how that went. And then they refused to sign any sort of documentation that I was in the hospital, like FMLA, all of that. They all refused it, said send that paperwork to your epileptologist, to your outpatient doctor. They'll do it for you. It was just a mess, man. And like now, and they didn't send me home. They said they were gonna send me home with Zofran because I was around the clock pain meds, around the clock nausea meds. And then I was on an infusion when they discharged me. They like unplugged everything, said, "All right, here you go. Now we got your MRI. You're good to go." And I'm like, "Okay, hold on. So you're giving me around the clock nausea meds and pain meds, and you're gonna send me home with like nothing. Is that what's gonna happen here?" No, and they're like, "Yeah, well, they sent me home with a antidepressant, um, and they said that that was for preventing the migraines." And I was in there supposedly for a status migraine, and I'm like, "Well, okay, I'd not really had a problem with migraines before, but now I have a chronic migraine that hasn't stopped. You guys have made it better, but haven't stopped it. So why are you telling me that you're gonna give me a medication to prevent migraines, but it's not gonna work for 3 months? That's not gonna be helpful. I'm not doing that. I'm not going on that. With all my other shit, that's probably only gonna make things worse. So, yeah, no, I've been sitting here managing my stimulation and just trying to get things, and I think it's starting to go away. It's starting to get a little less severe. But they didn't give me anything in the hospital. They were like, "Yeah, we don't know what kind of symptoms are gonna pop up because of this TBI. We don't know if they're gonna be permanent. We don't know if it'll get better. You might have to figure out how to deal with this for the rest of your life, and we don't know how to do that." So, that's pretty much what happened, and yeah. Not to mention when I get home from the hospital and my dad was out of town the whole time. And then he walks in and he's like from his out of state vacation. He walks in from his out of state vacation and I had just gotten home from the hospital the day before and I had to like text all over because my husband was at work. My mom was too busy getting her hair done and didn't want to pick me up from the hospital, so I had to text my sister's best friend to go with me hospital because everybody else was busy. And I'm just like, all right, whatever. All right. But I come home from the hospital the day after my dad gets home from vacation and he didn't say, "How are you? How are you feeling? What happened? What's going on?" He's like, "Why is the pool dirty?" And I'm like, "I'm sorry, but I have had like a killer migraine for 8 days straight. I'm not really concerned about your pool right now. I haven't been home in the past." Ugh. It's been a minute, yeah. It's been a bit, and uh, that was my nursing entrance exam that I had a seizure in the middle of, and, that was, like, recorded, proctor, online sorta thing. So, like, I was taking the exam, super focused, on top of it, got to, one particular math question, and I was staring at it, and it's like basic algebra, and I'm just staring at this math equation, but it wasn't registering in my brain, and I could tell that my brain wasn't processing, and next thing I knew, I was having a seizure. I don't know. I think I really freaked out some people on the other end of that proctoring exam because when I called in, they knew what was going on for sure. They knew that was the girl that just had the seizure on this proctored exam, and they saw all of that, and they saw me hit my head and all that, and that must have been like, I feel bad for whoever had to watch that because that was rough. That must have been rough to watch, and it was on tile floor. Yeah. So it's been a week, it really has. Now I'm
Sounds like it.
now I've been, just trying to manage everything, and I had my final presentation for the class for, like, my last class, um, a couple days ago, and I asked for an extension, and she gave me the extension, but I figured I'd just get it, knock it out, and do it. So, I spent up, like, 3 hours and just did the 10-page PowerPoint, got that out of the way. My head was killing me by the end of it, but I was glad I did it on time. I managed to get it in on time. I didn't want that thought of I still have to do this. I would rather have a killer migraine, and I'm just like, "You know what? Yeah, take some meds, grab some water, power through, and then just breathe a sigh of relief and marijuana after." Okay. It
There you
works.
go. So
It
you made it
worked.
through for real.
It's been a fucking crazy week.
Sounds
It's
like
just
it. So, I
another.
mean, prior to all this, what were the meds you were on? Like, how long have you had this diagnosis, and what medications did they have you taking?
I've been taking Xcopri for about a year and a half to 2 years. The
Oh,
maximum
okay.
dosage of Xcopri. I don't actually, I think it's been more like a year for the Xcopri, but I was diagnosed with epilepsy um when I started puberty, and I started having the absence seizures, and then I had a bunch of the grand mal seizures, and then when I started having the grand mal seizures, they didn't stop. So I was in status epilepticus where the seizures wouldn't stop. So I was in the hospital a lot from that. And then I had all sorts of seizures throughout my school years. So they had me on all sorts of like a cocktail, like a seizure cocktail. They had 20, I think I've tried over 20 different medications, and even more combinations of medications. They told me when I was younger that I would never be able to take just one medication, that I would always be on more than two or three medications at a time. And
It's hard to hear.
yeah, and it was pretty much like that. I was on about three or four medications until I got the VNS, and the VNS started working over time. Granted, it's at its max setting. Like it's my voice sounds totally different now than it did, because it's like super super up there. To like I feel it sometimes too. I can't
Yeah, that
use
was going to be my question.
the magnet um that you use, that like it turns it on to like 150%, and it goes off at 100% every like 20 seconds right now. But when you swipe the magnet for it to go 150%, like when I'm having a seizure or something, it's like electrocuting my throat. So I avoid that magnet like the goddamn plague. But yeah, it started to work. So eventually I just got, because the meds were kind of the hardest thing. It caused a lot of side effects, and I was not really, the side effects were almost worse than the seizures at some points. So I switched around on all sorts of different. He said I tried them all. He said this was the last resort medication. It was the Xcopri. They said is like brand. It was brand new at the time when I just started it. So he said like this is kind of our last resort, but we're gonna try you on this because you've been doing well, and or because I hadn't been doing well. And he at first I was taking Xcopri with like, I think it was Xcopri. I don't know if it was Xcopri and Zonegran, or it might have. Yeah, I think it was Zonegran. It was Zonegran or Vimpat, one of those. Um, yeah, but yeah, now I just have a bunch of metal and the Xcopri and benzos.
Have
Yep,
you ever had kind of a go-to favorite for a rescue med?
love me some Klonopin. I mean, as far as
Oh,
a
okay.
rescue med, that when I think of a rescue med, I think of something like that other people would have to give you. So the one that the nasal am where it sticks up your nose, that's best for if you're having a seizure, because you can get the medication to them without the risk of your finger getting bit off or something like that. But as far as, so the nasal am is great for that. I appreciate it. It's great. I've never been conscious whenever I've had it, but Klonopin is great for kind of getting you back down to where you need to be if you're feeling a little bit strange in your brain vibes, you know.
Okay, so you definitely know how each of these medications works for you. That's amazing.
Yeah, for me, that's been the longest, that's the goal is really having to figure out what each of these medications are doing, because when you're taking four or five different medications at once, and all of these medications, they have no idea. They don't know what symptoms are coming from which medication, or which medication is helping you, or things like that. So trying to narrow that down has been really the goal for me. So I've come a long way from since I was first diagnosed. Um, didn't think I never thought to ask if I'd ever be able to leave the US with these implants in, but uh guess that's the cost of being alive, I guess.
Hey, and you definitely handled that cost. So,
Still here.
wow, I mean, that back at when that exam you mentioned where you had the tonic-clonic, did you actually get a hold of that footage?
No, I didn't want to see that. No reason I'd want to see that, but I did mention it in the hospital that I had my seizure in the middle of my T's exam, and all the nurses like look horrified and, oh my God, what can I get you? Like, you're so nice. And oh my gosh, all the nurses loved me when I first came in. And then once I got the infusion of the Depakote, I turned into like this crazy monster that's just like coming at them all, like the Cookie Monster, just wanting to be sane, just coming at them all the time. And they were scared of me. And they just wanted me the fuck out of there. But those nurses, for some reason, I don't know why, but I had, over the time I was in there, 15 IVs. 15. Literally bruises all over my arms. There was like and only one of them was moved because I just didn't like it in the crease of my arm. And then they would try it in different spots, and then it would like either hurt when they're infusing, or there was one time where it infiltrated. So they were giving me a bolus of fluids. I'm not sure if it was a bolus of fluids or meds, but whatever it was gathering in this large bubble in my arm. And like the meds were going into my arm and it wasn't going in my vein. So I was pressing the call light. The nurse says, "What's going on?" I was like, "My IV is hurt." She looks down at my arm and she runs over and she rips it. She rips the IV out of my arm. And she was just like, "Okay, let's try that again." So yeah, I don't know. It's been a crazy couple of weeks. Just the past week has been crazy.
Absolutely. I mean, thank God they kept you in for 5 days, wouldn't let you out without the MRI. Did they end up going for two or just getting one?
They ended up doing it in one, but I was mind blown. I'm like, you guys should have figured this out. You've had 4 days to figure this out. And now, the one day after my insurance expires, it expired on July 30th. So I had from the 26th to the 30th for them to get shit done. And they call me the morning and they come in on the 26th. I'm so sorry, but I mean, this is what's going on. We don't have the MRI yet. They think they can get it scheduled for the morning. And in my mind, I'm thinking, if I leave now, insurance could say, because I left against medical advice, that they wouldn't cover the entire thing. So I had to keep going, and I got the MRI. I got the specialized MRI done on August 1st.
Wow. So that was an accomplishment for sure.
It
And
took
do you know
like
if
an
if it's covered at this point? Because it hasn't even been a week.
Well, what I'm hoping to do is we're gonna have to do like Cobra or something to extend the coverage a little bit to cover it. So, but that's gonna be like $2,000 just to extend that coverage so that we don't get $100,000 bill for that MRI or whatever. But it's just wild. The
Oh yeah,
MRI
there's a price
itself,
on everything.
it lasted like an hour. I was in that machine for an hour and they started it and they told me, like, at first they're like, okay, so it's going to be about an hour. And I'm like, wait, the whole process is going to be an hour, or I'm going to be in that machine for an hour? And they're like, oh, you're going to be in that machine for an hour, or it might be two because we need to get two, but we're going to try to do it in one. And I looked at him and I'm like, you know what? I'm already pissed off and I don't want to be in that machine for an hour. So please, can you send me up some Valium? Just put me to sleep. I'm happy to go in there. And they did. They did. And so I went to sleep in the MRI machine, woke up, and I was like, all right, please just get me the fuck out of here.
So you slept through that loud
Oh, yeah.
commotion
I
of an
was,
MRI.
well, yeah, because my head still hasn't they haven't gotten the migraine to go away. So but my head was hurting so bad. And like the migraines were making it hard to sleep. So, but that was the one thing I needed to get sleep, was to, um, that's not what I was trying to say. That's the one thing I needed, was sleep. So as soon as they gave me that Valium, and I was just really overstimulated at first because I was just pissed off and had the migraine, just like really in a bad spot. So that I was like, they gave me that, and I'm like, all right, great, I'm done. Let me go.
Amazing. So at this point, I mean, with the migraine rather, do you have any theories on, whether what part of the brain it was, like why it happened, like what the cause of that was?
The traumatic brain injury came from me landing on my head with the RNS, because I didn't just
Okay.
fall. I didn't just fall and hit my head. I landed on top of my head.
And that
Like
was
my
literally
whole,
last week.
yeah, no, it was
Okay.
2 weeks ago, but the symptoms,
Oh, okay.
I forgot like the whole week. Like 2 weeks ago, I
Okay.
hit my head. And then that following week, I didn't remember anything. And that's when the symptoms came on. And that's when I was diagnosed with traumatic brain injury. And then all the other symptoms were just
Oh,
from
okay. And
the
that's when you said the
traumatic brain
doctors told
injury.
you that that could happen, that it's not abnormal for a migraine not to pop up the day of a TBI.
Yeah, that
Okay.
like some of the more life threatening symptoms, like if you like you lose consciousness and they can't wake you up, or like something, traumatic brain injuries, that they have them in the hospital, like the really threatening symptoms will come up almost immediately, but the more less severe symptoms kind of pop up for like a week or a couple weeks after. Like that's not abnormal.
And that's definitely not something that everybody knows. So that's sounds
Honestly,
like
I don't
something
think
really important to
anything
learn.
I feel like I feel like a case study. I don't think anything with me is normal. It's not normal to have a person with two implants, all of these medications, all of these seizures. Like nothing for me is fucking normal.
So at this point, I mean, I can understand why taking the MRI or getting the MRI took so long to get it covered, but don't they have to? I know with the RNS, you have to get it kind of shut off essentially.
Yeah, it wasn't waiting for it to get covered. It was waiting for it to
Oh,
actually be able for them to figure out how to do it, because I have so much metal in my body. Because the um the VNS, this one, has like its own, it's MRI compatible, but they have certain instructions on how to do the MRI with the VNS. RNS is compatible, but it has its own specific instructions on how to do it. So they were trying to combine the two of them, since I have both, and they were just like, nope, it's too risky, because I mean, if they didn't do it right, then they have shit flying out of my head and chest.
yeah, that would hurt. And
That wouldn't feel good.
some doctor said you have to figure it out because you can't leave.
Yeah, exactly. Yeah, they're like, she has to
Wow.
get an MRI. That's not really, that's the whole point. And I mean, that was kind of my decision when I was sitting at home after I went to the doctor's office, and I had this killer migraine. I could not stop it, and I didn't want to sit at home with all of these symptoms that I couldn't really control and wait for them to do an outpatient MRI. So I went in and they somewhat controlled it. Like they definitely helped, but that was just kind of shitty situation.
Okay, so that other thing that I heard, the VNS, do you always have to swipe the magnet when you have the seizures? When what is the magnet for on VNS?
The VNS, um, so the RNS is responsive. It only goes off when it detects the seizures, but the VNS, it's kind of the same thing as the RNS, except for this one, it doesn't detect anything. It just goes off constantly. It's constantly sending those messages. So this one is constantly going off and sending the signals, and this one um directly sends the signals, but only if it detects something. So this is the vagus nerve, and the vagus nerve is pretty much an extension. It goes into the brain and everything, is like the main cranial nerve, but it's just more direct with the RNS, and this one's just constantly going off.
Okay, so when you and I understand you said your voice changed. So I mean, are there any talks about maybe seeing if one can do the job and removing the other? What's kind of the
Oh no,
plan
I
with all these
fucking love these.
devices?
I
Oh, okay, they
love
are
these
working.
devices so much because this over time, like it's supposed to work better the longer you have it, and it has. It's got me down. I was never supposed to be on just one medication, and I went 7 months without a seizure. Like it's really working. It does because it stimulates my voice. The electrodes are right here and it's right next to my voice box. So that's why it kind of makes my voice a little higher than it normally is, but because I used to have a super low voice, but now I have kind of a smoker's high voice.
But I mean, you speak so eloquently, so it seems like it's worth it if it's not painful, I'm assuming, right?
Oh, it's totally worth it. No, it's not painful at all. It's pain.
Okay.
It's somewhat. I'm gonna go ahead and try it. I'm just a masochist. Here.
I
So
mean,
we got
this is an
the
amazing
device,
demonstration, though. Thank you.
and I wave it over, and it gets like really high, and I feel the stimulation, and it's like making me cough. And I'm like, please just get it high. And it does that for like 30 seconds. It just goes stim, 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 stim. Yeah.
Wow. Okay, I'll never ask you to do that, just so you know. But that is pretty incredible to just know exactly how it's working and when it's working, because I was always kind of suspicious about the RNS because I can't feel the stimulation. So essentially I was wondering, did they even do anything when they made updates?
Um, the oh, sorry.
Yeah, no, take your time.
No, the VNS, I didn't really start to you do feel the VNS little by little, but I didn't really start to like feel it or have an effect until they started like pushing it all the way to as far as the limits could go. And it was working. It really was, but it only went so far. So that's why they had me considered for the RNS, because it was working, but needed a little bit help. So because this is more direct and only goes off, like it kind of balances itself, I guess. I feel like a goddamn case study.
No, but I mean, have you ever been to one of those learning hospitals? Just having, somebody who you can tell is kind of new on the job. mentoring with another doctor? Because it does sound like you would be an amazing patient to study, basically.
Um, all of my epilepsy, all of my doctors, I've been at UT Southwest for over a decade, and they're like a top research hospital, level 4 epilepsy center. So they definitely are studying me. Um, Most of it is pretty much like we're in new territory. We have no idea. You are not anywhere close to baseline. So with any sort of, I mean, for me, it's any sort of brain thing. They already have limited knowledge. And once it gets more and more complicated, like me, you're just in unknown waters. Like, doctors are not going to be able to give you any definite answers. You really got to learn how to work the medical system, not just work it, but like advocate for yourself and document what is happening and what you're taking so that you can figure out what's doing what. Because I used to have really bad fibromyalgia pain, and it turns out, and I don't even know which medication that was from, but it was from one of my other medications.
That's intense. So they actually diagnosed fibromyalgia.
Mhm.
Oh,
Diagnosed
wow.
fibromyalgia and all sorts of other things. Like I had um hype. I mean, my list is insane. I've had all sorts of stuff. And at one point last year I had that kidney infection because the meds were eating up my kidneys. And but yeah, the fibromyalgia didn't go away. Um Actually it did. It just over time it did go away. But it was one of the medications that I was on. And I just don't know which one. But that's I just have to kind of figure out what I do best on and what I feel best on, and go from there.
Okay, wow. So yeah, I'm seeing some anti-seizure medications are influencing on fibromyalgia. So was it like the gabapentin, pregabalin, those like really
I
strong
have
benzos?
no, it was more on the lines of high dose Vimpat, high dose Zonegran, um I think I took Briviact, like combinations of those kinds of medications, the really hardcore ones, but not just taking one at a time and taking like max doses of multiple. My body was reacting in ways that doctors could not explain. And because it was not affecting my day, I mean, because it was not like symptoms that were putting me in the hospital and that were going to actually hurt me short term, there really wasn't anything they can do. They said, sorry, you got pain, it's fibromyalgia, we've run all the tests. And then eventually, because I advocated, that's why I advocated for myself to get these surgeries, um, so that I could stop the meds. So I was just on a mission for a long time to get off of the meds, or at least lower the dosage. And I've been better since.
Wow, that's incredible. So you definitely know the benefits of self-advocating and keeping track of exactly what is going
You
on just to make sure everybody's on the same page.
I mean, with a brain disorder, if you are not being very aware of yourself and how you're feeling and the changes from different medications, like what you feel, you're not going to have a clue because the doctor doesn't have a clue. Epilepsy looks different in everybody, but trying to treat epilepsy as a general sort of thing is never, that's why they have epileptologists, but even epileptologists are just kind of thinking about cases they've done in the past that are somewhat similar, and then okay, we'll put you on this and see if it works. Like they're just trying, they're doing whatever they can, but they're just shooting shots in the dark. That's all epilepsy is.
Wow, so you
it's
felt like the
it's
epileptologist was still learn as you go.
like that's all they are. Epilepsy meds in general, they don't know why they stop seizures. They don't know why they keep them, and they don't know why seizures happen. They don't know why people have epilepsy. So imagine trying to solve this solution, this issue, find a solution when there's literally nothing known. They're just throwing shots at wherever they can. So you got to, I mean, that's, you have to be aware. I spend so much time begging the doctors, and I thought they weren't listening to me. I thought that they were just like not caring. But this whole time I realized you guys didn't really know shit, did you? Like you were trying, they cared, but and they were doing the best that they could, but there's just not enough knowledge on the subject for them to have any sort of conclusions. Any sort of brain injury or disorder is pretty much like running around in the dark. They're just going to
Guessing
try.
games. Yeah.
Yeah.
So when you were in the ER though, did you feel confident that when they were giving you all the medications and IVs and everything, in addition to the Dilaudid, that, there was
Oh, I
no
didn't.
negative
I took the
interactions?
Dilaudid on my own. That's um I had it left over from my kidney infection from like when they gave me the medication outpatient. And that's when I realized I needed to go to the hospital, because if I am taking what's equivalent to 14 milligrams of morphine and I'm still having a headache that I want to stab myself in the ears, then I should probably go to the ER because I cannot handle this on my own. So they didn't give me Dilaudid in the hospital. They don't do that for head injuries, but once I was in the hospital, I felt confident that I couldn't do anything else, and whatever they could do is more than I could do, is what I that's how I thought about it. So they were offering any sort of treatments, and I'm like, absolutely, go for it. Um, I didn't realize that the Depakote, because I came in like I might have been in a huge amount of pain, but I came in like nice and everything, and just me. And then I left like a raging devil, like a Tasmanian devil, because they gave me that Depakote, and I just like my mind, it was like triggering like psychosis or something, and I just went off. Like I
And you were
swear when I
discharged in that state.
yeah, I ripped
Wow.
my IV out of my arm, and I was so pissed because they wouldn't sign my FMLA form. They wouldn't sign my forms for work. They wouldn't do any of that. So I was really pissed when I left too. And I left after the MRI and all of that stuff. And I was August 1st is the day I left. And so I was already pissed, but I was still like, they had just given me Depakote, which I have a really bad reaction to, that kind of lunatic sort of reaction to. And I didn't realize what they were giving me. I was just like, you know what? You can give me whatever you want. I'm fine with it. But yeah, I had like ripped my IV out and there was blood all over the floor. I didn't give a fuck. I walked out like looking like Carrie on my arm, but I was not thinking for sure. Not thinking at all.
That's intense to say the least. I mean, now you can trust that that Depakote note is in your chart, I'm assuming.
Oh yeah, no, it's not in the chart. Nope, definitely not in the chart. They just thought I was crazy and whatever, but I told them that I did have issues with a lot of seizure medications, but my problem was I couldn't remember which ones, and they weren't really telling me what they were giving me. And the IV bag, it was labeled valpuric acid, and that's what they said it was. So that was like the generic name, or like the ingredients of Depakote. So the whole time I wasn't sitting there like crazed or whatever, but I just couldn't I was just thinking about somebody make it stop.
That
The
is
nurse,
intense to say the least. So you made it through this last week with all of that.
yeah, it was crazy. The nurse practitioner at UT Southwest that came in, that works in the epilepsy office, she used to work at a headache clinic. So she was the only person. They don't normally do nerve blocks when you're inpatient as a pain sort of relief. They don't typically do that, but she was the only one that knew how to do the nerve block. So she came in and she did a nerve block in every one of my cranial nerves, like all over and like all on my face here too. It felt like getting like, so she'd put it in the nerve and then move it around. So that was painful. Like she'd stick a needle up in my and put lidocaine and just move it around. And it was weird because like all of my, like the top and my skin felt numb, but my head was still on fire. So it was like, it was such a weird feeling to be completely numb on my head, but still have a headache and a migraine was wild.
Well, yeah, I mean, I'm trying to find some information here. When you said on every one, I'm picturing some kind of acupuncture looking procedure,
Kind of,
but
it was like that. But it was so what they did is they took, she had like a whole, think of whenever you're getting Botox or something, they line up a whole bunch of the needles, the lidocaine needles, and then they have like a whole map on, like they're just using like a picture that maps out the cranial nerves. And so she kind of puts a dot on each of the cranial nerves, and then one by one she goes into those nerves, she sticks the needle in the nerve, and then she moves it around to try to get the lidocaine all over near the nerves. So she did that with each one, and it worked. Like I was numb, but it didn't stop the migraine. It was just a very strange feeling. I don't think that's very normal for epilepsy. I don't think that's very epilepsy related, the nerve block, because that's not going to happen for most people.
no, but that
But
NP sounds like, or that nurse sounds like a godsend in your
no,
case.
she was a badass. She was a total badass. I loved her to death. She was and yeah, when you're saying they did have to come in and to turn off the devices before the MRI, and she was the one that did that. But they actually, as soon as I was admitted, they came up and turned off the devices, and they can't leave them off long because otherwise they're going to risk a seizure. So I thought I was immediately going to get the MRI. And then a day passes and they're like, I'm sorry, we have to turn this off. Like, they're not getting any, like, we have to turn this back on because we're not getting anywhere. And then I just sat in there with the thing on, was like waiting for something to happen. And then she comes in and turns it off again the morning of August 1st. They didn't actually suggest to do the nerve blocks. The NP said, well, I can do nerve blocks, but I'm not sure if they'll let me. So I remember her saying that, and when the doctor came in, she's like, yeah, we can do this infusion, but really there's nothing else we can do. And I'm like, what about the nerve block? This lady said she can do it. Throw it at me. Let's get it. She's like, all right, let's do it. Let me have it. Bring
Wow,
it.
so finally they finally listened to you on that one and everything. It
Well,
sounds like every step just needed to be approved.
I mean, it's not that they weren't listening to me. They were throwing stones. They didn't know what to do. They had no idea what to do. I mean, these kind of migraines, you can't, I mean, with migraines, they're not typically the kind of pain that you deal with regular. The other kind of pain, back pain, that's going to be more like opioids and anti-inflammatories and things like that. But head migraines and stuff, they're going to give you like antidepressants and epilepsy meds. Like they'll give epilepsy meds even to anybody else who's having a migraine, because I mean, they just give any sort of brain interrupting sort of drug to see if it'll stop it. They don't know what's going to happen, but they just throw everything that's brain related at it and see if it'll stop it. They do like the anti-inflammatories too, but they don't do, it's not normal pain control that migraine is in a different kind of bucket of pain control. Everything else is they have their own little thing and it's kind of generalized. Yeah, pain. We'll send you to a pain clinic. That's why there's the separate headache clinics because they don't know what the fuck to do with that.
So anything basically that originates in the brain you're seeing is like you said, a shot in the dark.
That's also why you're seeing a whole bunch of these new migraine medications come up, like the Ubrelvy and like Emgality and all of the migraine medications and the commercials. That's being really popular now because uh, 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 I'm sorry, my brain's buffering a minute. I gotta turn that light off.
Yeah, no, take your time.
What was I saying?
The reason for new migraine medications in commercials, it
Oh
sounded
yeah,
like
because
there's
they're
something of
not
an
they
influx.
can't find anything to really control it. It's
Oh,
because they
okay.
haven't
Yeah, that
really
makes sense.
found a way there's no cure, so they're kind of shooting in the dark. Um, so they just keep making, and that's the same. It's the same thing, and with any sort of brain thing with seizures, they keep making all these new seizure meds. They don't know what they do. They're hoping it works best than the last one or better than the last one. They hope it has less side effects. I mean, it's not really expected to cure it, but they're just hope it's throw it out there. Seizure medications, they made it illegal to put black box labels on them. The kind
Oh,
of
I didn't
black
know
box
that.
labels that you have on other medications to warn you, hey,
Yeah,
this is
those
super dangerous. It's illegal to
exactly.
have those on a seizure medication because they're afraid that it'll make people not want to take them for their seizures.
Even though they can legitimately cause manic psychosis and all these life-threatening side effects.
I mean, it's kind of the doomed if you do, doomed if you don't sort of situation. Do you want to have uncontrolled seizures or do you want to risk this medication? It might work, it might not, but either way, like it's gonna suck. You just kind of got to get through it. You got to
Yeah, I
find
understand
your
why
right
that's so
dose.
intimidating, especially when you're taking so many, but that's incredible now that you're down to one. I mean, that's got to feel like a victory for you.
It really is. I mean, that was the main goal of my epilepsy. I
Yes.
knew that I was never going to be I mean, this was always going to be something that is going to be a burden that I'm going to have to deal with. And I get it. I'm just different. Like, I can deal with that. You got it? Fuck yeah. I'm so proud of you. We're going to go out in a minute. Sorry, my husband just nailed a test.
Right on. Look like a celebration on the way.
He said he came in, he's like, so cute.
Excellent. Yeah, any good news after a week like that? More than welcome.
I mean, it hasn't been a horrible week just because of I think that I've gotten very accustomed to dealing with these situations and understanding the medical fields and not necessarily understanding what these, not learning medicine, like I'm not a doctor, but understanding kind of the doctor's perspective on this and like the nursing perspective and things like that, kind of the system. Um, really, really helped me kind of feel more comfortable to know, okay, it's not that they're not listening to me. This is just what our options are. Can we look at other options? Like, can I help find other options or can we go over these options? Like, what can we do? So, um, I just try to make sure that I give them as much information as I can and let them run with it and just let them know how I'm feeling. I definitely let them know the migraine is not gone, but it still hurt. Like, but it's not as bad, but it still hurts. Like, um, I don't know. I just kind of got used to that kind of hospital mindset. It's sort of a survival skill, I guess.
Yeah, and that's a skill that was definitely put to good use. I mean, do you agree that this would have been 100 times more terrifying if you didn't understand their perspective of why, the reasoning on why they were doing these tests and for what purpose it was?
Yeah. I went through that for
Okay.
years. I went through that whole thing, like, they're not listening to me, they don't care, I feel so alone, like, nobody understands me, and that's the kinda thing with epilepsy is you explain it to someone, but they're never gonna really understand. It's not about just the seizures. All of that time in between is still, like, it's the hardest part, that I had to deal with at least, just because of all this the how sick I felt. Like, I felt like I was on chemo for most of my childhood. I was in and out of the hospital. I had to deal with most of everyone I knew had seen me have a seizure. Boyfriends, I had a seizure at homecoming. They shut down homecoming. I had a seizure at concerts I went to. They had to pull me out in an ambulance, like, things like that. I've had to get kind of used to it, and I definitely went through that period where I thought I was alone. Um, and I don't know when exactly that changed, because that's the crazy thing I think about the brain, is that depending on what is affecting it and what your mood is and what your baseline is, just a different chemical or different, like, you're on one med and you feel this way. You're on this med, you feel another way. Like, you it's the crazy thing is that was the biggest scary thing for me is I was on all these medications. I felt crazy in all these different ways. So what was actually me? What is me and what is my epilepsy? Was kind of the whole thing that I was dealing with. So I went through that for a long time, and eventually I just started to learn more, and I think it really helped getting the job that I have. I work in healthcare. Um but I started to learn a little by little from the doctor's perspective and from the medical side's perspective, and it made me feel like, okay, so it's not that they think I'm crazy. It's not that they don't believe me. It's that they don't really know what to do. They don't have the cure. They don't have the answer. Like, you can ask them, they don't have the answer. They can try and help, but they don't. They just don't. They're doing their best. And so I figured just have to give them as much information as I can, without that was another thing is I have to give them as much information as I can without being too much. Like, I have to give them as much relevant information as I can, because when you get nervous and you're not medically trained, you'll just go on and on and on and on and sitting there talking, you haven't even reached this century yet. And so I had to get really skilled in that, in making myself, I mean, a patient. To be my own patient was something I had to learn, and had to learn to, okay, what is happening? What could be triggering this? How is and then a couple hours later, am I still feeling like this? How do I feel now? Like, just kind of always being aware, being my own patient, and that I feel like is what has gotten me through to now. And that's what made me want to not be a fucking patient ever again. That's what's gonna make me wanna be a nurse, is so that I can be, for once, on the other side of the bed, maybe help someone who's in the bed, but not be there myself, because that really sucks. Kept yelling at me on not yelling at me on the floor, but they're like, "You're not supposed to be out of bed, are you?" And I'm like, "No, but I really wanna go get some Starbucks, so I'm just gonna slip downstairs real quick," and she's like, "Well, you're wearing a yellow gown, you know what that means?" I'm like, I might be a fall risk, but granted, I'm epileptic, I'm a fall risk every day, just let me go downstairs." So yeah, they were, yeah,
That's amazing.
until
So
I
I
went
mean, this
crazy,
this
and then they
hasn't
were
even
just like,
stunted. Okay,
I'm
yeah, that's
sorry.
true. So no, no, absolutely. I mean, so I'm just really impressed that this hasn't slowed your goals at all. I mean, you're still going to be able to actually work with patients as a nurse.
Oh yeah, come hell or high water. I mean, granted, I'm not completely my brain, my executive function, um, things like that have like my vision even, my kidneys have taken a hit. Everything's taken a hit. I've had to get used to trying to function some with the fragmented thought sometimes when my brain will buffer. I mean, I just have to try to function with what I have instead of worrying about what I don't, and taking what I have, and taking care of myself, and hopefully it just gets better. Eventually it comes back. But really it was the limiting of the medications. Granted, those medications, those nasty chemo-like medications literally made my life miserable, but they also kept me alive. So it's that kind of trade-off. You just kind of that's the implant. Those I was ecstatic whenever I got the implant. I was like advocating for it. They didn't say, "Hey, I think you should get an implant." They did that for the brain one, but for the VNS, I'm like, I don't they wanted to just keep adding medications to like 6, 10 medications. I'm like, "No, fuck that. I want to go down." So, and he's like, "Okay, the only way we can go down is if we add surgery into the mix." And I'm like, "Let's do it." And it worked. It really worked. But if you ever want to move outside the US, make sure you ask first.
Okay, so that's what the RNS only being available in the US did that play a role? I mean, were you interested in relocating or just vacationing?
I was interested in getting the fuck out of here to universal healthcare company, like, or country. It sounds like the country is about to blow up on itself. I wanted to get out. So I was looking into moving to Canada, and I was talking to them, and they said, "Yeah, we don't provide any sort of RNS care outside of the country, outside of the US." Um so what would if I ever did want to move, I would just have to wait until the settings are adjusted completely for both of them. This one's already done, but it's going to take a few years to get this one adjusted. And then for the replacements, I would just have to fly back into the US if I decide to move outside.
Yeah, so that's definitely something to take into account. So all
Well,
that
granted,
experience, I mean, yeah, go
I'd
ahead.
rather be in the US and um living a decent life and happy and whatever, but completely broke as shit like everybody else, than to move outside of the country and end up dying in my 20s. It's
Yeah, I
trade
mean,
off.
worth the
It's
trade-off. Exactly. That's definitely what
survival mode is what
resonates.
it is. We have these kind of choices that we have to make as epileptics that other people don't and cannot even begin to understand. And it's just something that it is. There's no change in it. It's not that we don't have an option. We do have choices. I made a choice to not take my seizure meds. It landed me in the hospital. So we have choices. It's just got to pick the lesser aggressive option. If it keeps you alive, that's great. We'll take the medication and figure out how to feel better after, you know?
That's brilliant. So, I mean, have you ever contemplated how that really rough medical history as a child played into all this? I mean, do you feel, if anything, better prepared after the chemo and all that? I mean, talk about
Prepared
learning the
for
ropes
what?
young. Prepared for all of your, medical challenges currently. Because you said you
I
had
mean,
chemo when you were young, right?
Well, they were chemo. I mean, I was saying the meds were hardcore, like the hardcore
Oh, okay.
seizure meds. I did have a cancer removed about 2 years ago, but that was a precancerous little thing that it popped up on a pap smear. But I've had most of my um history. It started off in puberty, was really in the hospital. Most of it started most of that was just the epilepsy, and then the chronic pain kind of came when I was, like, 17, 18. Started to get worse from there, and, so I was dealing with that. No one could really figure that out, so I just had to figure that out on my own. So I was running around, and with the side effects I was having from the meds, like the nausea, the dizziness, the pain. They were sending me to pain doctors, to different neurologists that specialized in fibromyalgia. They wanted to get me checked with gastroenterology to control the nausea. Like, and it was a mess, a total mess. Most of my health bills are not actually from the epilepsy, but from the side effects of the medications that I was taking for the epilepsy.
Yeah, that's definitely a reality that a lot of us are surprised by. That's the thing that, I mean, did you feel prepared essentially when you first got diagnosed with epilepsy? Did any medical professional really let you know what to expect?
As a kid, I don't think you can really explain that to a kid, but I think in general, anyone who doesn't have epilepsy, um, doesn't they aren't able to fully understand their brain. They've never had their brain work in that way or not work in that way to where it's kind of like you see patients with memory loss or dementia, and they get really confused, and they know their brain's not working right, and like they're not there, like halfway there. And so I was it you can't really explain that to a kid. I don't think you can really explain that to anyone really. I mean, even if you have epilepsy, you might be able to understand, but you're never going to be able to fully understand someone else's epilepsy. You're never going to
Exactly.
be able to explain it to someone who doesn't have epilepsy. And it took me a long time to accept that, because even my family, they I mean, I wanted people to understand, and I wanted their compassion, and I wanted their empathy and support. And when I didn't get that, because people just assume you have seizures and in between you're just like everybody else. That's what people, even the doctors, that's what they think of epilepsy, sort of medically. They need to fix the seizures. Everything else in between is not their job.
Just unrealistic.
But it's not their fault. At least my doctors, it's not their fault. They only have so many resources, and they can't be using them to go and chase little in between symptoms. They have to keep people from dying. So I went that was that's what I spent a lot of my time trying to do. I spent a lot of my time chasing my own symptoms and trying to figure them out, and the chasing of the symptoms was what kind of got me down a rabbit hole of trying to find someone who understands, trying to not feel crazy, trying to not feel, and it did. It was a rabbit hole, but I had to step back, and instead of chasing the symptoms, just get data, just to look at it from another perspective. How am I feeling right now? I'm nauseous. How nauseous? What do I do? What have I taken? Like, and document that. And I did for a while. And eventually, I mean, after getting down off all these medications, this Xcopri, the only side effect I have is that it's making my vision really shitty. Like, I need readers now, and I refuse to wear them most of the time, but my vision has gone downhill. But besides that, Sometimes I'm more prone to nausea and like dizziness and things like that, but I'm not sure how much of that is just me and the brain damage caused by all the seizures. Because that's another thing people don't take into consideration is you got all this damage, it's going to cause you're going to see it. It's going to have an effect, but you're not going to
Even
know
if
what
it's not happening right
yeah.
now.
Yeah, so I
Yeah, we
was
understand that.
yeah, I was chasing symptoms and that wasn't really going anywhere, so all I could do was try to make it better day by day, and the only way I could do that was by doing the work myself, figuring out how I was feeling, and then just trying to keep myself feeling good. And if I didn't feel good, okay, so what's going on? And just doing that for myself instead of just calling my doctor. I feel so sick. Please help me. Doesn't go anywhere because they don't have time for that. They gotta keep people alive. They're not gonna give you the time of day for that because they got too much to do now. And it's offensive for a lot of people who are in pain hearing that. It's offensive, but it's the truth and it's not the patient's fault and it's not the doctor's fault. It's just how it is. It's just how
It is the system.
well, it's not just the system. It's just how naturally awful this disease is. It's unlike anything else. No one understands it. No one really gets how to solve that. There's no real information around it. It's a disease of mystery. So when doctors can't understand things, a lot of the times, if they don't have an answer, if they don't know, a lot of the times they will say, sorry, I can't help you. Go see this doctor, this doctor, this doctor, or this doctor. Or they'll say, okay, well, you need to go see a therapist. But I mean, that's just kind of what doctors do. They don't have time to be sitting there and chasing every little symptom. They're like, all right, well, you're not dying. So yeah, I really had to learn how to do that kind of stuff on my own.
Well, that's really well said. I mean, again, just impressed that you were able to take all of those negative and like terrifying experiences and actually use it as motivation to literally better your own life.
I mean, it was a necessity. It definitely was a necessity because I've had a great life. I really have. I've fallen in love and I have a wonderful husband. I met him when I was 18. We have this wild, romantic, beautiful love story. I do have parents who are supportive and they're helping me through college. I have a job. I have my animals. I have my little black cat right there who's trying to get on my lap, but I won't let her. I mean, I have a good life. So I have to live it as much as I can. And when you're feeling bad and when you're stuck to a bed and you're feeling internal because you're just having this pain and you're feeling sick and all that, you can't live your life. You can't live all that beautiful stuff in your life because you're so drawn in and focused on your headache or your nausea or how sick you're feeling or how crappy you're feeling. And I couldn't do that anymore. I was like about to explode and I did explode a couple of times. Like I that's why I was so determined to go outwards. Like when I'm in pain, I have to have something in the background watching. I have to do something to get my mind outside of my body and just focus on the world around me because otherwise you can you go into that hole inside of yourself and it never ends. You can't get out.
Yeah, that's an incredible way of looking at it, just the out of necessity.
And a lot of other people with I mean, that's epilepsy. You got this is gonna happen. This kind of shit, it's not nobody can explain it, nobody understands it, but it's happening and it's dangerous and it needs to be controlled. but they don't know how to control it, but they're gonna try. And sometimes controlling it feels worse to you personally than it not being controlled. And you just got to do what you got to do to stay alive and work to be to live your life.
Yeah, so I mean that balance, that kind of happy medium is another
Yeah,
just basically lifelong challenge.
it's a lifelong challenge. It's yeah. I mean, I'm a case study. We all are. Everybody with epilepsy is a case study because they barely know how the brain works in a normal person. They don't know what seizures are. They don't know how it affects long term. They don't know any of that. So we are all case studies, not just me with the metal and everything, little Terminator over here. All of us with seizures and brain disorders, they don't know how to help. They want to help. So to the general public, I've had to train myself to not get personally hurt or offended by someone that doesn't understand because they don't have that capacity to understand. They've never experienced it.
Yeah, absolutely. So, I mean, do you have a kind of go-to explanation for those who just ask that blanket statement of what's epilepsy? How do you explain your condition?
For the most people that ask about the epilepsy, um, by the time that I'm very blunt. I'll tell them, yeah, I have the kind of fish seizures. My brain kind of electrocutes itself. I have an implant here, an implant here. By the time I'm done kind of giving a very, very generalized explanation, they're like, what did I just ask? I'm so sorry. Like I it usually doesn't get past that point because they don't ask questions because they're just terrified of the idea of that. But that's normal. I mean, I'm kind of used to being the one that's known as a brain damaged friend. I've kind of embraced it, you know. I might be brain damaged, but I'm a hell of a lot functional than more of a lot of people who have brain. So I'm gonna do as much as I can with the tiny amount of brain that I have left. And I'm gonna kick your ass, even though you got a full brain, but you're a little bit dumb, sir.
There you go. You lay out the facts like that, they're not going to have many more questions.
No, I've never had any trouble explaining to anyone. I mean, I don't usually try to explain to anyone unless they ask specifically, but usually when they ask, they regret asking because it's one of those conversation killers where you're just like, "Oh, what does that mean? You have epilepsy? What's that like?" And then you're just telling and they're like, "Oh, that's a bummer." Like, "Can we talk about something else?" sort of thing. Yeah.
So I'd love to hear your perspective. One of the questions that we ask pretty often is what's the best piece of advice that you've received about epilepsy?
I've received.
Right, right. Did
Um,
anybody ever give you just some really insightful knowledge about this?
no. I every everybody tried to tell me how to feel and how to process the information. But until I processed it myself and really took the time to go through that, um, I didn't really fully accept or understand. So I was no, there wasn't any advice that people could give me because they just didn't get it. Um, is how I felt. I just felt like nobody really got it. And everybody's words were just it kind of felt like I'm trying to find the word
Maybe
for it.
isolated?
Platitude,
Oh, okay.
like trying to make you feel better. Everything kind of
Yeah,
felt like that, you know?
gotcha.
I didn't really get any good advice from external. It was really whenever I took the time for myself to be like, "Okay, I have this beautiful life. I need to live it. I these, have a lot, more on my plate than most people have to deal with." Then really, I mean, they don't know, they can't walk me through this, so I have to walk myself through this and really figure it out. I just really had to learn to rely on myself, rely on my own strength, and, um, to change perspective a little bit for sure. Because I got lost in the pity pillow for a while, just kinda, you know, and, there's nothing wrong with that. Sometimes that's just what you need to do, but I just had to figure out what to do. I mean, I didn't really get anybody else's advice that changed my life before my epilepsy. It was just me learning how to deal with it and to emotionally process it. You get a little stronger every time. You surprise yourself with what you can get through.
All right. Well, that definitely sounds like you're the one prepared to give the advice at this point. You're really keeping it organized with that timeline and all those
Man,
events and everything that you're able to still remember. That's the way to do it.
I know my life. I know my life, but I don't know any of yours. I don't know what you guys are going through. So, I mean, I that's how I got through mine, but everybody's gonna be different. I can't pretend to know what it's like for you guys to have epilepsy because it's such a generalized term. It's
Yeah,
really just
very.
kinda you gotta find that strength within yourself, and you got the option. You can have a seizure and look at it and just be sad and whatever, or you can look at it as, "Oh, I just went 7 months seizure free, and we're making progress, and I might be postictal, but I managed to finish that fucking test." I did. I got up and I was postictal still, and I was like, "I have to finish my test right now." And I got a 53 because I had the seizure halfway in between the tests, so I got a 53.
So that definitely warrants a retake.
Well, um, they're when I called them, because that was my retake. Because when I was taking
Okay.
it for a second time because I thought the first time my Wi-Fi had cut out and that test wouldn't be that I wouldn't be able to use that
Accurate.
test.
Okay.
Yeah, so when I called them, they obviously knew who I was and what just happened. I'm sure that someone was on, Teams going, "Oh my god, this girl just had a seizure in front of me," and
Yeah.
it when I called in, they knew, and, they were like, "I don't want you to worry. I already talked to everybody. We're gonna make sure that first test is great. And by the way, I just wanna say how great you did. Like, this is amazing. You're fantastic." And I'm just like, "Okay, great, cool. Thanks. Do you think I could get a refund?" Unfortunately not. All right, thanks. You're great. All right, bye. But it's choosing to look at things in a different light has been a key point for me.
Yeah, that's incredible. Not, I can't think of the word, but not focusing, I guess, so much on, like you said, the negativity and the obstacles, but more on how to overcome.
'Cause there is that negativity that's gonna be there, that pain, that suffering, that is valid, that it's not, um I mean, that's the kind of hard part that you have to balance. You gotta give yourself enough grace, like, if you're in pain, if you're having a headache, if you're feeling nauseous, um, that was the hardest part, was me trying to not feel lazy and to try to feel like I was good enough and to meet the world standards. It was lazy versus sick, and was I really, like, too sick to go take out the trash, or was I just being lazy? Like that kind of thing. So that's how I kind of got to the point where I would do things like finish a test after I've just had a seizure, or clean my room when I have a migraine, or get home from the hospital and finish a 10-page PowerPoint. Like that kind of shit is, I mean, it kind of, it's not good for me, but it's proof, it's my own proof of what I can do when things get hard. Like we have these obstacles other people don't have, and if we can do this with these obstacles, then we're kind of badass, you know? Like
Yeah, you're that much stronger for it.
exactly. So that I have to look at it that way, because otherwise I don't want my life to be focused on the obstacles. I want my life to be focused on my life.
Yeah, that's a great way of looking at it.
Yeah, because
And so
that
far, it
was a
is
hard
definitely working for you.
hard lesson to learn for sure, was how to balance the pain, not just the pain, but just the suffering versus being lazy and other people and their perception of you. Because when you're in bed all the time and not feeling good, and other people start to look at you like, oh, she's disabled, she's bedbound, she's just
Yeah.
lazy. Like they'll start all their other, and I just had to zone that out. And at the end of the day, I just started doing literally as much as I can when I can. And if I don't, like, I have to give myself a lot of grace. Like when I'm not feeling good, I don't mind spending the day just sleeping, but I will get
Yeah.
up the next day and get to work. I it's a
Don't lose
really,
sight.
really tight rope to walk,
That's
and
a
it
great way of
always
doing
will
it,
be.
though. Well, I mean, we're definitely grateful to have you part of the universe now on the in season family, and yeah, we're definitely excited to have you. So you know about the Tuesdays and Friday meets.
I do, but I will have to like put in my calendar or something, because my brain is like not recognizing what day it is, or what, at all. So I'll forget.
Oh yeah,
But
we're all there.
there was someone that I saw posted about, it was a guy, and I think he's new, and he posted to Epilepsy Universe, I think, but I mentioned your name, like I left a comment. He was having a hard time, um like he'd just gotten diagnosed, and one of the things he was concerned about was passing it along to his children. And I told him
Okay.
that's been something that I've been having a hard time with as well. But I spoke to Kate, and I put your username, and she helped me work through that fear. If you want to reach out to him, I think that would be really a cool thing to do.
Absolutely. Okay, so you said it's probably within the last couple days
One of the newer posts, yeah, he was like the
you
military
posted.
guy that
Okay.
had a seizure, and um was just diagnosed with epilepsy. And so he's kind of going through all the feels of that. And on top of it, the whole kids thing is going to pass through anyone with epilepsy is going to have that thought. So maybe just kind of a talk with you can help less that burden.
Yeah, absolutely. Okay, yeah, so I have some time. I'll scroll through that and see what I can find. But yeah, again, thank you for taking the time. If you ever, want to have another one-on-one with either me or Pookie or, whoever, then let us know.
Well, it's
But
good to
yeah, I
talk
don't
to
want to slow you
you.
down from your celebration.
Oh, yeah, we're going to go and hang out and be very, very excited that he passed his test, and now he's on to the next one, but you got to have something to celebrate.
Absolutely. Okay. Keep making those goals have reality, and we'll keep being proud of you for it.
Talk to you later.
Nice to see you. Later.
Bye.